I do the checkup phase of the triage clinic, and so my part is education, and I kind of am the closer of that whole process of triage clinic. And because nurses are so cued into the health aspects of people and people with addiction problems, we really strive to give them the information about how important it is to quit smoking. If they're on board with it right away, we do a 5A questionnaires and then get them to Al, and then he takes over from there. Some people, decline right away, and they say, oh, I'm not ready for that. I have this problem. And so we talk about it as an addiction rather than just something that we want them to do because it's for health reasons, but it being another addiction. Now we have something set more as a program and something more to document than just saying, discussed smoking cessation. Now it's like we've been able to offer this, and so we've moved it, one step forward.
Penny's instrumental, her and Lori, without them interacting with the clients and to get them interested in the first place, I wouldn't have anybody probably come upstairs. I'm very pleased that the mental health recovery services were able to integrate this into visiting and asking every client that comes in if they're interested in quitting, and also at least providing referral information to the quit line. I think that's successful. I know people have called that number, and of course not everybody wants the assistance or cessation assistance one-to-one, but we have helped about close to 15 individuals this year. And I would say as far as the numbers who have actually wanted more information, it's probably been closer to about 75 to 80 individuals that have received that information. And I think over the course of a year, you see about 250 clients in the mental health outpatient clinic. Is that?
Least, yes.
Okay, at least. So over 250 clients. So we're getting quite a few of them that are at least in the pre-contemplation stage, and they're thinking about it. And I think what's important is that Penny and Lori are helping them move to the next stage to make that quit attempt. And
we've had a few successes. Some people have actually, been able to completely quit smoking, and when they come in, they're so happy, and they just feel much more healthy.
The information and the staff support that were provided, it was very important, and then certainly Mac, with your training, and then with Chris coming up here, and we trained about 30 individuals from 2 different organizations. It was really very helpful. I know that those individuals really got a lot more information about the different FDA-approved medications that are available, why it's important to certainly assist these individuals, why we kind of have an ethical responsibility, I feel, too, in helping these people, and it's certainly good for our services that we provide in Health and Human Services. It's definitely a gap that I've learned that we need to fill. I think that's an important step, an important advancement in a change in sustainability that this has made for our community.
I think that we're on the right road, and I think we need to continue because they need this help.
Providing tobacco cessation and treatment to this population is essential, that it's important that the services are provided to those individuals. Many of them are highly motivated, they want to quit, and they do it well.